YouTube channel. And in succession to the videos, what I have been taking up these days on obstetrics and gynecology, another very important questions, whatever queries which can be very frequently asked in your exams in obstetrics and gynecology when you are given a short note to write on ectopic pregnancy. So today I'll be discussing about that what are the symptoms of ectopic pregnancy. So before getting into the symptoms of ectopic pregnancy, let's discuss how and what is the condition of ectopic pregnancy in brief. So basically, the fertilization, the pregnancy, it begins with the fertilization of an egg, and normally the fertilized egg attaches to the lining of the uterus. So in cases of ectopic pregnancy, the ectopic pregnancy is going to occur when the fertilized egg implants and grows outside the main cavity of the uterus. So if this is a schematic diagram what I have drawn, and actually before the pregnancy sets in, the uterus is going to prepare itself for the implantation. So this uterus becomes richly supplied with blood vessels, and it is actually once the fertilization has taken place in the ampullary isthmic junction, the fertilized egg slowly and gradually will proceed from the fallopian tube and will finally get implanted into the uterus. So this was the case with a normal pregnancy, and most of the cases the embryo is going to implant and fix itself into the wall of the uterine cavity. But when it comes to ectopic pregnancy, the word itself is referring that it is locating a site which is other than the usual site. So in such cases, the most common site of an ectopic pregnancy, in certain cases it has been found that the fertilized egg, instead of getting implanted into the uterine cavity, it implants somewhere else other than the uterine cavity. So if most common site for an ectopic pregnancy, the other common site where the embryo can implant itself, it is in the fallopian tube. So most common site of ectopic pregnancy, it is the fallopian tube, because during ectopic pregnancy the embryo is going to implant at sites which is other than the main body of the uterus. So in most of the ectopic pregnancy cases, the most common site, it is the fallopian tube, and once the fertilized egg is going to implant into the fallopian tube, this type of an ectopic pregnancy, it is called as tubal pregnancy. So this is tubal pregnancy. And apart from this, apart from tubal pregnancy, there can be various other sites where the ectopic pregnancy can take place. So the embryo can either implant to other sites such as the ovary, the abdominal cavity, as well as the lower part of the uterus. So this is the lower part of the uterus which is called as the cervix. So the embryo can either implant itself either in some cases during in an ovary. Apart from this, it can either implant itself into the abdominal cavity, or it can implant itself in the cervix, which connects the uterus to the vagina. So these are the other sites where the ectopic pregnancy can take place. But most common site for an ectopic pregnancy, it is the tubal pregnancy, where the embryo is going to implant itself into the fallopian tube. Now, so this video will be the main focus of this video is to let you know that what are the symptoms, what can be seen during an ectopic pregnancy, and if a woman is suspicious that whether she is having an ectopic pregnancy or not, so what all signs or symptoms what she can look for to ascertain whether her pregnancy is normal or not. So initially, the symptoms what are there in a normal pregnancy, initially the ectopic pregnancy cannot be detected, and the initial symptoms are more or less equal to that of a normal pregnancy. So during a normal pregnancy, there is the symptom of nausea is there, breast tenderness is there, a missed period is there. So during an ectopic pregnancy also, the pregnancy test will come out to be positive. And this test, even in ectopic pregnancy, the pregnancy test is going to come out to be positive. And initially, there are no as such symptoms which by which a woman can ascertain or confirm that whether it's her normal pregnancy or an ectopic pregnancy. So initially, all the symptoms what in a normal pregnancy is seen, initially those same symptoms are seen in an ectopic pregnancy as well, which includes breast tenderness, a missed period, and nauseating. So however, some women may visualize certain early symptoms. However, so the early symptoms can be looked upon as there are certain early warning signs. If it is a case of an ectopic pregnancy, one may look for certain early warning signs, which can be in the form of a light vaginal bleeding as well as pelvic pain. So actually, it is the pelvic pain which is the very, very important differentiating factor. So if it is an ectopic pregnancy, the expecting mother can have an pelvic pain she can see. As apart from this, there is light vaginal bleeding. So this has not to be confused with the bleeding of miscarriage, because during the miscarriage, the bleeding is there, it is more intense, and it is associated with certain clots. So a miscarriage bleeding is absolutely different than an ectopic pregnancy bleeding. So the light bleeding in case of an ectopic pregnancy can be either in the form of a mild spotting, or the little bit spotting can be seen in cases of ectopic pregnancy. So this light vaginal bleeding or spotting can be seen as the first earliest and the warning sign. Apart from this, the expecting mother is going to have such pelvic pain in the lower abdomen. She is going to experience this pain. And if actually, if this ectopic pregnancy, the fertilized egg, it has been normally seen that this fertilized egg cannot survive. So during an ectopic pregnancy, the fertilized egg is not going to survive, and ultimately this may cause bleeding. And if the bleeding is there from the fallopian tube, you may feel a shoulder pain. So very, very important, I would like to highlight this point, that the earliest warning sign of an ectopic pregnancy, wheresoever in a tubal pregnancy, the if bleeding occurs during the initial time, it could be referring to some kind of a shoulder pain, or the expecting woman can have at that point where this bleeding is happening, she may have the urge to have bowel movement. So these are the two earliest warning signs. Firstly, she will be having, if the bleeding is there from the tube, from the fallopian tubes during a tubal pregnancy, so she can have shoulder pain. Apart from this, she can have the urge to have bowel movements. So these are the two earliest symptoms, and the symptoms what depends on actually from where the bleeding is taking place. That is the most common ectopic pregnancy is the tubal pregnancy. So in this case, what do we see is that the earliest warning signs can be looked upon as from where the bleeding is taking place, all right, and where the blood is collecting, and during that bleeding what nerves are getting irritated. So the what nerves are getting involved during such a bleeding. So this is actually the which is going to give the early warning signs of an ectopic pregnancy. So the symptoms can vary from one woman to another, depending upon the extent, the amount of bleeding, and where the blood is collecting, and what the nerves are getting irritated in that particular region. So that will be ultimately going to cause the referred pain to as in the shoulder region. Apart from this, she can have the urge to have bowel movements. Apart from this, moving on, now once this early warning signs, if it is not being detected even that at that level also, so the ectopic pregnancy, the fertilized egg is not going to survive. And it has been mostly seen that then if it is in the emergency symptoms, so in the next symptoms, it is the emergency symptoms. And in emergency symptoms, what do we find is, so earliest warning signs we have already discussed. Now we'll see to the emergency symptoms. So in the emergency symptom, if the fertilized eggs continues to grow, so if this is the picture, what if I've shown this tubal pregnancy, so if the fertilized egg is going to continue to grow in the fallopian tube, if this continues to grow in the fallopian tube, slowly and gradually this may lead to the rupture of the tube. So even the fallopian tube can get ruptured because of an ectopic pregnancy, which is if the embryo is getting implanted and if it continues to grow. So even the fallopian tube can rupture, and once the tube has got ruptured, that will lead to heavy bleeding inside the abdominal wall is most likely to happen. So if the tube is getting ruptured in any way, this can lead to heavy bleeding in the abdominal wall, and the extremes of symptoms can be seen in the form of extreme lightheadedness. So such women, if bleeding has been continuous, if bleeding is persisting, if tubal rupture has taken place, so such women are going to experience extreme lightheadedness, fainting can happen, they can go into a shock, shoulder pain accompanied with pelvic pain, and the vaginal bleeding will persist. So these are the extreme warning signs, and this should be very importantly taken into consideration that during the late ectopic pregnancy, the symptoms what can be seen, these are the emergency symptoms. So once the tube has ruptured and there is bleeding just because of an ectopic pregnancy, it is in the case of tubal pregnancy, these all symptoms may be manifested once the bleeding has taken place due to rupture of the fallopian tubes. So if these symptoms of extreme lightheadedness, the pelvic pain, the vaginal bleeding, the fainting, shock and shoulder pain is there, very importantly, the expecting lady should consult the doctor immediately, and it is actually the emergency symptoms which needs immediate treatment. So this ectopic pregnancy, if the bleeding is not being controlled, so that can even lead to the growing tissue in the fallopian tube can cause bleeding to such an extent which can be even life-threatening if it is left untreated. So viewers and students who are, I hope this video would be helpful to you, because ectopic pregnancy, the treatment of this, I would again emphasize that if this growing tissue is left untreated, if it is going to cause tubal rupture, so in such cases this ectopic pregnancy can be even life threatening. So one must immediately consult the doctor or the healthcare professional. So viewers, I hope I have simplified what are the symptoms what are associated to ectopic pregnancy, and what are the early warning signs what are associated to ectopic pregnancy, as well as the emergency symptoms what can be looked for an ectopic pregnancy. So if viewers and students, if you like this video, give this video a thumbs up, and students and viewers who are new to my channel, haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.